I'm Donna Hanover, treating the whole person, body, mind, and spirit. Both doctors and patients alike are embracing the whole person approach to healing. It's not just traditional medicine anymore. Science and You starts now.
I'm Tinabeth Pina. How about getting a prescription for a dose of bee venom or leeches instead of an antibiotic? That's coming up next on Science and You.
Sitting inside of this tank for an hour may not sound like a lot of fun, but it may be just what you need to help tune out the rest of the world. I'm Andrew Falzon. That story's coming up on Science and You.
Hello, I'm Magalie Laguerre-Wilkinson. The next time you have that cold and you want to run to the drugstore for that medicine, remember, there could be an alternative. That's coming up on Science and You.
I'm Mike Gilliam for Science and You. When pets are sick, stressed out, or dying, it's common practice to reach out to the vet. But there are alternatives that can replace pills and surgery. One of them is animal Reiki, and we're going to tell you all about it on Science and You.
I'm Donna Hanover here at the Mount Sinai Beth Israel Center for Health and Healing, which is the Department of Integrative Medicine. Some healing approaches, once thought to be far out, are now considered significant by many doctors.
The center's medical director, Dr. Martin Ehrlich, explains the concept of integrative medicine.
It's medicine that integrates all of the wisdom of the various systems of medicine that have been going on for thousands and thousands of years. So Chinese medicine, Ayurvedic medicine, indigenous medicine from countries and cultures all over the world. Much of Western medicine is really about pathophysiology. For example, when I go to medical school, when you start medical school, the first thing you do is dissect a corpse and spend a year studying disease. There isn't a course on why we're healthy, how we stay healthy.
Here at the Mount Sinai Beth Israel Center for Health and Healing, they offer care that includes acupuncture, yoga, Japanese Reiki therapy, meditation, massage, aromatherapy, nutrition education, and physical therapy. They are also primary care doctors and believe Western medicine does have great value.
It's fantastic for so many things. If I go out there and get hit by a car, I want to get the best orthopedist and the best doctor I can to put me back together again. And yet, with all our advances, technological advances, for much of the ills of society, much of the chronic diseases, the arthritis and the heart disease, and we haven't really those effective treatments. We can put in a bypass and put in a stent, but in 3 months later, 6 months later, patients will be back with their next heart attack. For us, in integrative medicine, we like to focus on things that are relatively low-tech, relatively simple, and often under the control of the patient. Their diet, their exercise or lack of it, their habits, good or bad. There's a lot of root causes that begin in lifestyle that can often play a role in helping to treat people and help them heal or prevent disease.
Dr. Ehrlich says the body has a natural inflammatory response that is part of healing, where certain molecules rush to attack an infection or invader. But this often causes painful swelling, heat, and redness in conditions like rheumatoid arthritis. Inflammation is not so obvious, but very damaging in type 2 diabetes and heart disease.
Inflammation turns out to be a really common factor that underlies almost all chronic diseases.
Dr. Ehrlich says studies have shown that many patients who meditate reduce the level of inflammatory molecules in their blood, as well as their heart rate and blood pressure. Meditation can also help patients who need relief from pain.
John Kabat-Zinn at the University of Massachusetts back in 1970 started a program called Mindfulness-Based Stress Reduction that taught people to meditate, to relax, to breathe, people from all sorts of departments would send their patients from pain, from oncology, from cardiology, because they had done everything they could with these patients, and they were either still in pain or they just weren't progressing. That 8-week course turned out to be incredibly successful for almost anybody who came, whether they had irritable bowel syndrome or whether they had chronic pain, they would improve. We do that here. We have courses all year long. It's one of my most common prescriptions for patients, and it's powerful.
Dr. Ehrlich is trained in acupuncture and believes that some non-Western medicine works by affecting the thin membrane throughout the body known as myofascial tissue.
This myofascial tissue, the stuff that we don't really understand very well, that covers all our organs, it covers our muscles, and connects and sends messages all over.
Besides what is offered at the Center for Health and Healing, Dr. Ehrlich says there is evidence to support other healing modalities like pet and music therapy.
Are there any of these wacky things that you've heard about that you really want to say to people, don't do that, or bring that to your doctor before you start doing that?
I'll have patients that come in here with 2 shopping bags full of supplements, and sometimes my job is to get them to put their supplements away. Vitamin D, vitamin K, vitamin A, those supplements can build up to toxic levels without people knowing about it. Mm-hmm. That certainly is something that I see not infrequently.
Doctors who practice solely Western medicine send him patients who want to try integrative medicine in hopes of avoiding surgery or drugs.
Really a more inclusive medicine that looks at the entire potential that we have to help people heal.
So many healing practices that were once derided by Western medicine are now getting a thumbs up from some doctors. The idea is to take a holistic approach to patient care. I'm Donna Hanover for Science and You.
I'm Tinabeth Pina. Back in the day, doctors relied on nature to help their patients heal. Nowadays, those folk remedies are resurfacing, allowing people to turn to bugs and not drugs for treatment.
I've always thought that the bee sting was the original acupuncture needle. So it's not that big of a surprise that people are going back to some of the, quote, older remedies.
Frederique Keller, a licensed acupuncturist and apitherapist, uses all the products of a honey beehive medicinally.
So each of the products of the hive have a specific function within the hive and also medicinally for human consumption as well.
Like what?
So the raw honey would be good for desensitization of allergies. It's good for promoting sleep at night, promoting digestion. The pollen would be good for, it's pure protein, so it would be good for, as a nutritional supplement. The bee venom is obviously good for, as an anti-inflammatory, to relieve pain for various conditions.
Although there is no proven scientific evidence supporting the use of apitherapy, it can be used to help manage the symptoms of various diseases.
I would see it more as an adjunct treatment because it is so little known, especially here in the Western country, especially in the United States, that many people come to it as a last resort after they've gone through a lot of drug therapy and other therapies.
Many years ago, about 7 years ago, I was very sick with Lyme disease. I had done the antibiotics for a very long time and they were not working. They would get me to a certain point but not get me better. And I'm really glad that I came because it helped me a lot. It really took the pain away, took the inflammation away. I would rather do this and then take all sorts of medications that can have negative reactions.
Bee venom has a powerful effect on the circulatory system and stimulates the release of cortisol while facilitating the elimination of toxins and metabolic waste. It can lessen inflammation and help regain movement for arthritic patients. But before treatment, you have to get tested for allergies, since 1 to 5% of the general public is allergic to bees.
For new patients, she'll do a testing just to show you how it feels and just to make sure you're not going to have a bad reaction to it. The first maybe 10, 15 seconds, it's a pretty strong, sharp sting, but it's not bad.
Another folk remedy handed down through the ages is Hirudu therapy, better known as leech therapy. These bloodsuckers have been around for thousands of years and were approved by the FDA in 2004 as a medical tool for skin grafts and reattachment surgery. They are also used outside of the OR as an alternative treatment for mild to moderate medical conditions.
Outside of neural medicine, we usually see leeches as parasites, but no, they're really little pharmaceutical factories.
Dennis suffered a hematoma while playing soccer and turned to leeches to bring down the inflammation and relieve the pain.
No bruising left over right now. And the swelling, it went away in a day, as opposed to if I would have been just taking any sort of home meds, say ibuprofen or acetaminophen, it would have taken weeks to achieve the same result. The leeches exchange their saliva with you, so they exchange anesthetic, which numbs all the feeling. They exchange anticoagulants, which makes the blood flow better.
The myth was that leeches, they suck out the bad blood, so-called bad blood, and they have to be big and gorge, and they have to depart from the host. And it's not true. It's the primary indication and primary benefits from the chirurgotherapy is injection of those substances. The proteins go to our body, and then oozing, the second step, from those little wounds what the leech creates, there is a post-discharge and a release of the accumulated toxins.
Leeches are only used once per treatment and are euthanized immediately. They can help relieve migraines, varicose veins, skin and gastrointestinal diseases, and can even help treat glaucoma and cataracts.
Do you literally put the leech on somebody's eyeball?
No, we don't. No, they are biologically active points when you apply the leeches, and again, they affect the smallest vessels in circulatory system and in the eye as well, and that's why you can take care of eye diseases. We do apply leeches. It's a local chirurgotherapy. When the tissue is involved, it's damaged. We're going to the essence of the chirurgotherapy. It's the blood, and the whole health and life is in our blood. Other words, when the circulatory system works and the microcirculation restored, you get back your balance, you get back to homeostasis.
For those of you that might be a little too squeamish, there is an alternative to leech therapy. Scientists have developed a mechanical leech that can perform some of the same duties as a live leech, but without what some of you would call the gross out factor. For Science and You, I'm Tinabeth Pina.
I'm Andrew Falzon. Sitting inside of a dark box for an hour may sound more like a torture technique than a rejuvenative therapy, but if you need to escape the daily grind, you might just be able to float your way to rest and relaxation.
In Sweden, they've done research where flotation is actually used and covered by insurance to treat headaches, to treat depression, to treat anxieties.
While most Americans probably haven't heard of float therapy, in other parts of the world it's already considered a routine medical treatment.
The newer name for it is rest therapy or rest flotation, which is restricted environmental stimulation therapy. So that's kind of the best way to describe it, where you're in a restricted environment.
Rest therapy was the creation of Dr. John C. Lilly, who did government research in neuroscience in the 1950s. Though his later studies ventured into the exotic outskirts of science, he's considered the founding father of rest therapy. Rest therapy was originally called sensory deprivation therapy because it attempted to turn off all input to the brain. Lilly and his fellow scientists thought lack of input would put the brain to sleep, but it turns out they were wrong.
A lot of people will also experience hallucinations as well, where they'll start to not necessarily have major hallucinations, but they'll see colors or they'll maybe hear some subtle sound.
Robert Schreier is a doctor of physical therapy and co-owner of the Aspire Center for Health and Wellness in Midtown Manhattan. His practice uses innovative approaches like a bungee harness to rehab leg injuries or a zero-gravity treadmill that makes you feel like you're walking on the moon. One of his more unique therapies are 2 float chambers. While research into exactly how flotation therapy affects the mind is still ongoing, Dr. Schreier has observed that most people enter the chamber as stressed New Yorkers and come out feeling much more relaxed.
So most people will say that they essentially feel like they're falling asleep or they fell asleep. And then when the time is up, they kind of come out of that experience and they feel like they've only been in there 10, 15 minutes, even though an hour and a half has passed.
The float chambers come in all different shapes. One of the chambers at Aspire is shaped like an egg, the other like a box. The bottom of each is filled with about 24 inches of water. They're totally enclosed, but even those with claustrophobia can still float.
You have no sound, you have no really sense of awareness of where you are. You're in the dark. And also the water is skin temperature. So after about 10-15 minutes or so, your body kind of blends in with the water.
Also in the water is between 12 to 1,600 pounds of dissolved Epsom salt. This makes the water incredibly buoyant, allowing the floater to levitate with absolutely no effort.
So I really describe it as an experience where you're taking away all sensations and you're being left with only your conscious or subconscious brain.
Nick Viselli has been floating at Aspire for about a year. He says the sessions have helped him cope with what can be a stressful career as an actor. Having tried meditation and yoga, which can take years to master, with flotation, Nick says the results were instant.
The tank closes and you are in a period where there's no light, no sound. You are deprived of your basic senses. And just doing that will literally force your body into an automatic relaxed theta state, which is the state that you try to achieve when you meditate.
As part of our story for Science and You, I decided to try it for myself. I laid in the tank for about 10 minutes before I fell into a deep, comatose sleep, an experience that other floaters have had as well.
It was 90 minutes, but it felt like 20 minutes. The door opened at the end, and I'm like, wait a second, it's over already? And you come out of the tank feeling so relaxed.
If you think flotation therapy may be for you, it's a good idea to consult your doctor first. If you need to find a float center in your area, head online to flotationlocations.com. I'm Andrew Falzon for Science and You.
I'm Magalie Laguerre-Wilkinson. We're here at the New York Institute of Aromatherapy to find out if these little bottles will heal the mind, body, and spirit. Amy Galper is the executive director and founder of the New York Institute of Aromatherapy. While it seems like a relatively new phenomenon, she's quick to remind us that there's nothing new about aromatherapy.
You know, aromatherapy is just a form of herbal medicine, and before pharmaceuticals were around, human beings used plants as their medicine. We forget that plants have been around since the earth was created. We forget. Whereas aspirin, I mean, maybe that's a little over than 100 years old or something like that. And even most of the modern drugs that we know didn't even exist in my parents' lifetime. So we often forget that really the first place that people reached to was their garden or was the forest in order to feel calm or soothe their digestion or increase their reproductive urges or whatever it might have been, that plants were what we reached to at first.
What is the biggest misconception about aromatherapy?
I would say that people think that it is about fragrance and perfume and it's something to kind of mask out other odors, and they don't realize that it's actually a healing modality, that it's actually a part of herbal medicine. What makes, I think, aromatherapy so powerful is that it affects both the physical body and the emotional, psychological, and spiritual body at once. So if we're taking herbal medicine, let's say echinacea has become very popular, right, to boost your immune system when you're feeling sick. So that's a direct application of an herbal medicine and its kind of therapeutic actions. But it doesn't really have an aromatic element to it. Aromatherapy uses those active plant materials that affect our body physiologically, but then we also smell it, which affects our spiritual, emotional, and our psychology, how we look at the world, our state of mind.
The most effective ways to use aromatherapy are through the skin or by breathing it in with a nebulizer or an inhaler.
So the molecules of the essential oils are broken down either transdermally or through the respiratory tract or through the olfactory passage. And then those molecules then get exchanged with the blood vessels, so it enters our skin. So there's a lot of research showing how these plant molecules actually affect the chemistry of our body.
Galper says that lavender is one of the best multi-use oils.
This is a lavender that is wild harvested, meaning it's not farmed in an industrial way. They actually climb up above 10,000 feet in France and gather it on the mountainside. The best way to smell an essential oil is just to kind of hold it a little bit under your nose and just breathe normally while holding it back and forth. And that way you get to really experience the whole bouquet of the flowers.
Oh, what a dream. You close your eyes, you're in a field in France.
Yeah, it's beautiful. That's a really nice one. So how would we use this? You just get one of these empty little spray bottles, like maybe 1 or 2 ounce, fill it with water or distilled water, and then I'll put 2 or 3 drops of lavender, or maybe if I want more, 10 drops, shake it up, and then I'll just mist myself throughout the day to help me calm down. If I'm feeling nervous, or I missed the train, or I'm late to the meeting, I'll have it in my purse and I'll just spritz myself to just chill out.
You can also mist lavender to treat cuts, scrapes, and burns, because it's also a great antibacterial and anti-inflammatory agent. If you're not feeling well and you don't know where to start, where to begin, what is the best way for a person to want to treat themselves?
Well, they can make an appointment with an aromatherapist, with someone who is trained in aromatic plant medicine. The practitioner is approaching you from the whole person, looking at your psychological, spiritual, physical areas. She finds out about maybe what the cause of the issue is, or maybe the certain symptoms that you need to immediately address. She will actually make a customized product for that person that is uniquely designed to affect the physical, emotional, and psychological issues.
So the next time you feel that headache coming on or that stress, instead of reaching for that little pill, try some essential oils. I'm Magalie Laguerre-Wilkinson for Science and You.
I'm Mike Gilliam for Science and You. Reiki, it's not new. Energy has been around forever, and they've used it to help humans for a very long time. But more and more people are using animal Reiki to help their pets. Let's take a look. Participants in this animal Reiki class in Soho look inward first, preparing themselves to bring comfort to animals through their spirituality.
So I encourage all of you, when we're working with the animals today, to be peace with the animal, be harmony with the animal, be compassion with the animal. This is all we do when we do Reiki.
Kathleen Prasad is the author of 2 books on animal Reiki and the president of the Shelter Animal Reiki Association. She also teaches classes around the world. So what is animal Reiki?
Reiki for animals, in one sentence, I would say it's meditating with animals for healing.
How does it work?
So Reiki actually is a spiritual practice which utilizes a lot of different techniques to help us get into a meditative, peaceful space. And so when we use the system of Reiki with animals, it's sort of like this: peaceful heart, peaceful mind, peaceful animals equals healing.
Prasad says you never grab, touch, or force help on the animal. Instead, you offer the help and let the animal choose whether to accept it or not. Much of the training has to do with deep breathing and seeking a sense of balance.
When we're humble, then we're balanced. So when we are balanced, the animals sense this and are drawn to our energy, especially if they're having difficulty. So if they've been abused, if they've been traumatized, if they are ill, perhaps if they're transitioning, if they're dying, they're drawn to that space of balance. It's like a space of well-being that we learn to radiate, and they can step into that space and it helps them. It helps them to remember their own self-healing and their own balance, their own harmony, so it can really help them with whatever issues they're dealing with.
Sue Pfeffer is from Toronto. She says she used animal Reiki to help her pet rabbit, Coke, when he was dying and having trouble breathing. She says she meditated near the animal.
I put my hands nearer to him, and it felt to me that he needed the comfort of my hands, so I just put them over top of him. And as I kept my hands around him, his breathing slowed down, and he seemed to relax, and I was so impressed. When his breathing had slowed down to the point that he seemed very comfortable, I just wrapped him up in a little blanket, and I felt my hands go cooler, and he was he'd had enough.
She says she wrapped Coke in a blanket and he passed away overnight in the blanket and in the same position.
I believe he died in a much happier state because of Reiki, and it helped me.
Jenny Hughes is a Reiki practitioner from Doylestown, Pennsylvania, who applied the technique to her ailing cat, Huggies.
He was diagnosed with pyonthorax, which is a condition that you usually need surgery for. It's when you get fluid buildup in the thoracic cavity. And there's usually surgery involved that requires tubes, and he was 16, and through antibiotic treatment and Reiki treatment every day, a month later the fluid was gone completely from his thoracic cavity. And veterinarians mostly said that it doesn't happen without surgery.
Animal Reiki has also been used to alleviate bad behavior in stressed out pets. Liz Wazell worked with a terrier mix named Phoenix, who was a stressed out, lost Superstorm Sandy survivor.
She was hyperactive and on all the time, and everything set her off.
Eventually, through Reiki, she settled down and was adopted by a loving family. So maybe for a dog that's really stressing, does this kind of cut all of the noise?
Yes, it can actually help animals to tune out the outer chaos and tune in to their inner quiet.
Now, I would imagine that naysayers would say, what is she talking about? You know, you take the dog to the vet if the dog is stressed and get medicine. You know, what would you say to them?
And I agree. I take my dog to the vet. I love my vet. And I take my dog to the acupuncturist, and my horse gets chiropractic. So I think every animal and person, really us too, we need a combination of therapies. And for me, it's the blending of the conventional with the holistic. That's the perfect combination. So maybe you take your dog to get surgery, and then when they're home recovering, you offer them Reiki. And Reiki can help with side effects from medications. It can help with recovery from injuries and illnesses. So it actually just supports the process of veterinary care. It is not a substitute.
And followers say it works.
I recommend it for everybody, any age, any type of animal. It's such a calming therapy that anyone can handle it and anyone can benefit from it.
Now, if you want to learn more about animal Reiki, we'll have information on links that you can visit at the end of the show. I'm Mike Gilliam for Science and You.
That's our show for today. See you next time on Science and You.